All right, good morning, everybody. Welcome to Pediatric Grand Rounds. My name is Mary Leonard. I'm the chair of the department. It's my great pleasure to welcome you this morning to our last Grand Rounds of the year. We will do a couple announcements. Very, very importantly, Friday is Faculty and Staff Awards Day. We have an incredible variety of awards and so much talent in this department, so much to celebrate, so much to honor both the people who've won prior years and the associate chairs who will be participating in this award ceremony, and then the incredible recipients. So please come and celebrate with all of us, really across all of really important, impactful awards across all of our mission areas, including advocacy and DEI. And then I want to just call your attention next year. The Kretschmer Lecture is always the way we kick off. The Norm Kretschmer Lecture is always the way we kick off Grand Rounds after the new year. And we're so pleased that Bob Vinci is coming out, who's just a real leader in pediatric education and specifically some work he's doing around the subspecialty workforce. Grand Rounds is Tuesday morning. Somebody asked me if we would continue to be Tuesday, continue to be in this room after the new year, and the answer is yes. However, Labor Day, Memorial Day, when Monday is a holiday, Grand Rounds is on Wednesday. So that's just a note, a shout out that it will be Wednesday after Labor Day. And on the left is the information you need for CME and MOC. And next slide, please. And our land acknowledgement, we recognize that Stanford sits on the ancestral land of the Ohlone tribe. This land was and continues to be of great importance to the Ohlone people. Consistent with our values of community and inclusion, we have a responsibility to acknowledge, honor, and make visible the university's relationship to Native peoples. Next slide. Again, I just, at the risk of repeating myself, and it was actually fun to look at this picture and see the names of the recipients who got the awards in the past: Christina Vera, Sarah Heigelberg. You can see what a wonderful celebration this is in these prior year. Next slide. And again, I've already given a plug for Grand Rounds, but these are just some of the highlights that we'll be having coming into the new year. I know everybody will be excited about that. And then again, we have this room on Tuesdays or Wednesdays as needed, but there's a couple times when we don't because of other events. And so those will be virtual. And so just keep an eye out for those as you get your Grand Rounds invitations. Remember, there are occasional ones that are virtual. We'll make good use of those times as well. All right, I am so pleased that Baraka Floyd, our Associate Chair for DEIJ, is going to welcome this morning's Grand Round speaker, who's coming for a homecoming, I would say.
Good morning, everyone. My name is Dr. Baraka Floyd. I use she, her pronouns, and I'm so excited to be able to introduce one of my former continuity clinic residents for Grand Rounds today. Dr. Matthew Meyers is an assistant professor of pediatrics at the University of California in San Francisco. He received his MD degree from Geisinger Commonwealth School of Medicine and his MPH from Johns Hopkins Bloomberg School of Public Health, He completed his pediatric internship at Boston Children's and his residency here at Stanford and graduated in 2017. At UCSF, he's a DEI champion and serves as a program director for the UCSF Adolescent Medicine Fellowship. His scholarly work focuses on healthcare transitions, educating providers to care for transgender youth, and access, detection, risk reduction, and treatment for substance use in children and youth. Dr. Meyers is also a recipient of the Hallie T. Davis Academy of Medical Educators Innovation Funding for Education grant for his substance use work. I must just add that this is a really exciting day for a lot of us in this room because we had the pleasure of working with Dr. Meyers during his training. So without further ado, Dr. Meyers.
Thank you, Dr. Floyd, for that very kind and I'll say generous introduction. Thank you, everybody, for coming. Thank you for having me. It's a huge honor to be able to come here in a form of a reunion to give Grand Rounds to the pediatric group here. So wanted to start by just kind of sharing a little bit of my background. I knew coming into training that I really wanted to focus on LGBT health and spent a lot of my time, both in pediatrics and fellowship, really trying to round out my skills and take advantage of whatever opportunities I can find, both from a clinical education standpoint and a scholarly standpoint. So I am very excited to have this time with you all today to kind of share some of the tips and skills that I've learned along the way. Title of the talk today is Pride Moving Beyond Acceptance, starting with the obligatory disclosure statement. I, nor any of my immediate family members, have any conflicts of interest to disclose regarding this presentation. When I was asked to do this talk, I sat and thought to myself, what does pride mean to me? I really wanted to make sure that I captured that in this talk and centered that as my why for this conversation. On the surface, it's a really simple question, but the more I thought about it, it became increasingly complicated to answer. How does one put to words the immense breadth of history, the challenges and successes the community has faced, and the unwavering hope for a better future that we all see during the month of June, but throughout the entire year as well? I think each person's connection to pride is unique to them. It's deeply personal and equally valid. But for me, when I was thinking about what pride means to me, I kept coming back to three main things. The first one is honoring the hard-fought progress won by those who came before. Second is reflecting on contemporary challenges facing the community. And the third is a call to action to create a more welcoming and inclusive world, specifically for this talk regarding pediatric patients that we see collectively. So using that as a scaffold, I put together some learning objectives for this talk, which does mirror that, starting with a few slides to highlight some of the landmark moments in queer history, a few slides outlining contemporary challenges to the inclusion of LGBT youth that exist today, and we'll close with some tools that we can all use as providers to help promote resiliency and inclusion in the clinical space. So, like I said, I wanted to start by walking through a short and, admittedly for the sake of time, incomplete history of queer liberation and the fight for equality. This picture comes from a scene outside of Compton's cafeteria. This takes place in 1966 in the Tenderloin of San Francisco, and Compton's cafeteria was a common place for queer people and drag queens and trans people to get together and have lunch and have dinner, and just existed as a safe space, which unfortunately in that time was also a place that was continually and regularly raided by the police. And in 1966, there was frustration that led to a riot around those police raids that predated the more famous similar situation in Stonewall by 3 years. So I wanted to put this in here as an example of what some people identify as one of the larger movements towards queer liberation in San Francisco, and also just a little local plug for our place in history. More famously, I think people are probably more familiar with the Stonewall riots that were in 1969. Similarly, this was a place for queer people to get together and just have fun and be happy, which also similarly was often raided by police. This is in New York City, and one particular moment during a raid, there was a lot of frustration and pushback, and the community decided that they had enough. And that was largely regarded as one of the pivotal moments in queer liberation. A year later, the community in New York City got together and decided they were going to honor that moment by having a parade, which was known at that time as the Christopher Street Liberation Day March. A year after the Stonewall riots in June marked that date and became kind of the first gay pride parade that existed in the United States. And I put this picture up specifically to highlight Marsha P. Johnson here, who was one of the main figures in the Stonewall riots, and is largely attributed to one of the more powerful voices that came out of that movement. This image comes from a few years later in 1973. This is a snapshot of the American Psychiatric Association in the deliberations around whether or not they wanted to continue to include or remove homosexuality from the DSM. This picture for me is particularly powerful because if you look at the person on the right, that's a person wearing a mask. He was introduced during the meeting as Dr. Henry Anonymous, wore a tuxedo that was 3 sizes too big, spoke through a microphone that distorted his voice, and wore a mask that he fastened out of a Richard Nixon mask. He used that disguise because at that time wasn't comfortable saying the words that he said in that meeting, which were, "I am a homosexual, I am a psychiatrist." And that was a really powerful moment and very pivotal in the conversation around whether or not homosexuality needed to be included in the DSM. And because of that advocacy and all the people that came before him, in this moment in 1973, homosexuality was removed from the DSM. So again, a really powerful image there. This is something that most of us are probably familiar with. This is the original gay pride flag. I put gay in parentheses because it's pride flag now to be more inclusive. But kind of like taking a step back in history, thinking about what people used to wear to identify themselves as members of the community stems back to initially a pink triangle, which was used as a way of honoring and reflecting on LGBTQ folks who were lost in Nazi concentration camps. In the 70s, Harvey Milk asked Gilbert Baker, a local San Francisco artist, to develop another form of representation and inclusion for the queer community, out of which came what we know as the pride flag. If you look closely, there's a hot pink and a dark purple on the sides, which no longer exist. Funny historical fact is that turns out that those color dyes at the time were expensive and hard to find. So they shortened it to the 6 colors, which we now are probably more familiar with. And then this has become ubiquitous in the month of June as a representation of the LGBTQ community. On a little bit of a more somber note, but focusing on the activism here, ACT UP is a group that was really coalesced to carry out daily acts of civil disobedience and nonviolent protest in order to focus more attention on the critical issues regarding the AIDS crisis in the 80s. And so this group was really fundamental in pushing the government to really kind of pay more attention and focus on issues with HIV and AIDS at the time. And of note, this movement was largely driven by tremendous contributions from the lesbian community. Fast forwarding a little bit to the 2000s, this is a scene from protests outside of the Supreme Court during a court case titled Lawrence v. Texas. Not going to focus too much on the history leading up to it because it's a little bit tragic to talk about here, but this moment in history was super influential and important in that it officially, through the Supreme Court action, struck down homosexual conduct laws, which criminalized same-sex sexual conduct. And at that time, it basically was touted as the legalization or the removal of the illegalization of people being queer. So very pivotal moment in history. Again, fast forwarding a little bit more, here we have President Obama signing the official repeal of Don't Ask, Don't Tell. Don't Ask, Don't Tell, for those that are less familiar, was a law that allowed people to serve in the military as long as they did not divulge their gender identity or sexual orientation, effectively making people make a choice between being part of the military or living an authentic life. So the repeal of this allowed people to be open about their sexual orientation, their gender identity in the military. This is an image, I love this one because it's just like sheer exuberance and excitement. This is a photo of Edie Windsor in 2013. She was the person who filed the initial court case that made it to the Supreme Court that ultimately struck down the Defense of Marriage Act, which allowed a federal law to remain in place recognizing same-sex marriage throughout the country. And just the look on her face walking out of the courthouse just kind of captures how that moment felt for a lot of us, including myself. Side note, I also got married in 2013, so that was a really exciting moment and it kind of coalesced in a very beautiful way for me. Also, I just kind of wanted to highlight the many different faces and many different voices that have been integral to the movement throughout time. Of course, this doesn't capture everybody. There's not enough time for that in a 1-hour talk, but I wanted to highlight some of the more poignant historical figures that have been part of the queer liberation movement. Alan Turing is one of them. Bayard Rustin is another one. Part of the civil rights movement, worked alongside MLK. Frida Kahlo. Larry Kramer is a very vocal activist who started the ACT UP movement. Sylvia Rivera, famous trans activist from the 70s. Laverne Cox, more contemporary, is a very outspoken vocal trans rights activist. Similarly, Elliot Page, Janelle Monáe, Carl Nassib, who was the first out professional athlete in a major sport in the United States. Alfonso Butler, our current California Senator, Harvey Milk, Pete Buttigieg, presidential candidate, and Dr. Rachel Levine for all of us doctors out there. I know I talked a little bit before about the initial pride flag, and I wanted to put this up here as the progress pride flag, which is an updated version of that flag that really started becoming prominent in 2021. The evolution of the flag really kind of mirrors the desire and the efforts towards inclusivity that have existed in the movement. And it started with the Philadelphia Pride flag in 2017, which existed as the initial rainbow flag on the right with a black and brown line across the top above the red, to really being more inclusive of people of color in the movement. That has changed to become overlapping triangles on the left in the progress pride flag now, to acknowledge and honor the intersectionality of race, sexual orientation, and gender identity through, again, the black and brown to honor people of color, pink, blue, and white to honor the transgender community, and the yellow with the purple triangle to honor the intersex population. So it's evolving just like the community is to be more and more inclusive, and I wanted to kind of put that up there as a symbol as such. So coming back to the initial slide talking about what pride is and what it means to me, I'm going to take this as a moment to transition to the second part of the talk, reflecting on some of the contemporary challenges that face the community today. First, I wanted to start by the tragic incident that happened in the Pulse nightclub back in 2016. People went to a nightclub to have fun, and for far too many of them, that was the last night that they were able to do it. And this is an image of the 49 people that were murdered in that nightclub episode. This is one incident. Similar incidents are happening throughout the country at a far too common rate. Another thing that is happening, that is a message that trickles down to the collective psyche of youth today, is what I will call the Don't Say Gay bill that passed in Florida in 2022. Governor of Florida, Ron DeSantis, signed this law as titled the Parental Rights and Education Bill, which was aimed to prohibit classroom discussion about sexual orientation and gender identity, effectively limiting teachers and educators' ability to represent the full diversity that exists in our communities. Similarly, there are bans across the country coming into place, banning gender-affirming care for youth under the age of 18. This is an image of one protest from Indiana. This captures what the landscape looks like across the country regarding similar bans. The text is really small, but you may notice there are asterisks on a lot of these. Some of these bans are in place. The asterisks indicate that the law is either currently being considered, currently passed, or being held up in the courts. I think notably yesterday, some of you may have gotten this ping on your phone too, the Supreme Court, given this constellation of varying laws throughout the country, decided to take up a case out of Tennessee. And the thought is that that could soon determine a federal statute around the availability of gender affirming care for people under the age of 18. So it's a really critical time for this country right now. And I think we're at a pivotal moment that hopefully will allow an expansion of access, but time will tell. Another thing that is happening throughout the country is bans on public drag performances, a uniquely queer expression and art form. Across the nation, people are passing laws, or I guess I should say attempting to pass laws. One of them has gone through, which again is also being held up in the courts. But whether or not these laws are passed, the messaging that young people receive from kind of hearing these conversations has a tremendous impact. And then finally, the Equality Act, which has been stalled in the Senate. It passed through the House, but has been stalled in the Senate since a year ago. Federal law, as it stands, does not explicitly provide non-discrimination protections based on sexual orientation and gender identity on a federal level. Despite significant steps forward for the community, Americans in many states continue to experience discrimination. And the patchwork nature that exists now without a federal statute leaves millions of people subject to uncertainty and potential discrimination that impacts their safety, their jobs, their families, and their daily lives. So moving to the next section, the part that might be more salient to us as pediatric providers is the call to action. What can we do? How can we counter some of these negative messages and uplift the voices of youth in a way that creates a more welcoming and inclusive world? I wanted to start by putting this image up. It's a young person standing in awe, excitement, fear, hard to know without being able to see this person's face as a wave approaches them. And this is kind of how I envision emerging adolescence. It's a tidal wave of information, messages that are coming at you nonstop all day, every day, as you're trying to find your footing in the world, which might not always seem super stable. Words and messages the youth are exposed to have tremendous power. And as you can imagine, like I was saying before, the messages that I chose to highlight and all the other messages that are exposed to these people do trickle down into their psyche and their collective psyche of youth in general, specifically around sexual orientation and gender diversity. Young people can only learn and absorb what is shown to them. With that information, they are able to eventually find their place in the world, either within or beyond what has been demonstrated to them. The truth is, many young people at this age and beyond have a really clear understanding of their gender identity and their sexual orientation. The challenge comes from queer and gender diverse youth spending far too much time in their lives searching for the tools, the safety, the words, and the agency to share what they know about themselves already with the world. For some youth, remaining in the cisgender heterosexual binary feels right and comfortable. For others, it doesn't. For some, it's all they've been exposed to, a trend that is hopefully becoming less and less common with time and activism. And for others, the sad reality is that remaining in the closet around their gender or their sexual orientation is a necessity for safety. Because of that, many queer and gender diverse youth don't get the chance to grow up living an authentic expression of themselves. And our job as providers, and the challenge or the call to action I pose to you today, is to do whatever we can to promote authenticity, to demonstrate allyship, to meet young people where they are, step away from whatever acculturated perceptions and assumptions we have, to simply listen, allow our patients the space to share their truth, honor that truth, and lift up their voices. In this talk, I want to focus on some of the really pragmatic ways to do so and support and celebrate, moving beyond acceptance, the authenticity around sexual orientation and gender, with an emphasis on really ground level clinical encounter tips for the patients that we see collectively. So why is this work so important? Why is this something that I'm here talking to you all about? Why is this something that we as a group can do better on? A large body of national surveys, including the Youth Risk Behavior Survey from the CDC, National Survey on LGBTQ Mental Health organized by the Trevor Project, and a report Growing Up LGBT in America by the Human Rights Campaign, just to name a few, have aimed to directly research the LGBT community. In that research, notably from the YRBS study released recently, it found that 15% of youth surveyed as a representative sample identified as LGB. 9% reported questioning their sexual orientation, and little shy of 2% of high school students identified as transgender or other when asked about their gender. This cuts across urban, suburban, rural, and all racial and ethnic demographics in all 50. So all that to say, these youth exist in all of the communities in which we practice. So knowing that these youth are there, we're seeing them, I think it's super important to understand some of the health disparities that may have existed and may continue to exist over time, so we can better understand the needs of the community as pediatricians. So one of the things that we know is that the LGBTQ community does demonstrate higher levels of depression and anxiety. This image captures it nicely. This is from the RBS study from the CDC that I referenced before, grounding you in what the text of this means. The percentage of people that responded to the survey in the study is outlined here. LGBT students unsure about their sexual orientation or heterosexual peers as a reference group. And then the bottom two gets into sexual behaviors regardless of sexual orientation or identity. And as you can see, the trend of LGBT or unsure students is significantly higher than their heterosexual peers. And that also applies to sexual behaviors where 64% of people having same-sex partners report feeling sad or hopeless, with only 35% of those who have only opposite sex sexual partners. That trend also exists when you assess suicidal ideation and suicide attempts. And so this slide is a little bit busier. It's a little bit more inclusive of the varying types of sexual orientation that was assessed in this study through the Trevor Project. But as you can see, the rates are quite high. This study is one that focuses only on the LGBTQ community, so there is not a heterosexual reference group in this, but this data highlights the very high levels of both suicidal ideation and suicide attempts that exist in the similarly, when focusing in on gender identity, you can see that the rates are higher, significantly higher in the transgender and non-binary or questioning community when compared to the cisgender boy and girl community. And again, this is cisgender within the LGBTQ community. Substance use is also something that's been studied by YRBS. Same data outlay here shows that 23% of LGBT students compared to 12% of their heterosexual peers reported using illicit drugs in the last 30 days, whereas the same trend also holds for those with same-sex partners when compared to those with only other sex partners. Disordered eating is another thing that comes up fairly frequently. This image captures adults. I couldn't find a specific image for youth, but in my anecdotal experience, I would say that similar trends hold, where heterosexual women have a rate of 16, a little over 16, and heterosexual men have a lower rate. Bisexual women and gay men do have very high rates as well, noting that this is something that's super important to ask about, screen for, and connect patients to care when they arise. And then last of the, again, admittedly incomplete list of health disparities, the last of the important ones that I wanted to focus on today was bullying at school. And as we know, this has a tremendous mental health impact. And so I wanted to put this up here to, again, highlight the similar trends that exist here among LGBT students and those who have same-sex partners. While these reports don't attempt to ascribe causation, one can imagine the multitude of health disparities that can arise as a function of social isolation, bullying, mental health, and the anguish of just not being able to fully express a part of your identity, meaning that it's super important for us to kind of create that space for young people as providers to be able to identify and acknowledge these issues as they arise and make sure that people get the care that they deserve. So what can we do? As pediatricians, we have the ability and responsibility to promote resiliency in all of our patients. This is particularly important for the queer and gender diverse communities. Creating a space that allows youth to feel comfortable sharing their private, sensitive information affords us a more meaningful clinical interaction, greater success with follow-up, and a better ability to address the many aspects critical for healthy growth and development. So some of the key points that we can focus on a ground level start by just creating affirming spaces and allowing patients to share their authentic experience. being able to screen for and treat whatever co-occurring issues arise, and connecting patients to medical and mental health supports when needed. Starting with creating affirming spaces, there's a few specific things that have been studied and proven to be really helpful to allow LGBTQ youth to feel supported and comfortable in a clinical space. And I wanted to highlight a few of them today. One includes staff training. So in addition to the healthcare providers, front desk staff, nursing staff, MAs, and many others are on the front lines of patient care and interact meaningfully with the patients that we see. So focusing solely on what we say in our engagement doesn't sufficiently kind of capture that and allow us to create a space through all touch points that is affirming for young people. And so a lot of organizations have created specific healthcare staff training that has been really powerful for us in our clinic. One group that we've worked with is the UCSF Alliance Health Project, and they have a team specifically dedicated to putting together training modules to help clinics with staff engagement and staff training and better understanding the needs and the tools to create more affirming spaces. Just also very simply, posting affirming posters or having information in the waiting room is really important. Things that are as simple as hanging a flyer just really kind of create a sense of safeness and ability and allow people to feel more comfortable in that space and sharing that sensitive information. Again, also very simply, having all gender bathrooms or allowing people to use a bathroom that matches their gender identity. Fluency of terminology is also really important. I wanted to put this slide up just to kind of demonstrate the many different flags that exist within the community and the many different identities that exist both from a sexual orientation and a gender standpoint. And then also really importantly for us as providers, leveraging the EMR to ensure as much as we possibly can that those identities, if shared, are respected both during our encounters and future. Epic, which I know from residency you all use here, we also use at UCSF, has a really wonderful tool called the SOGI tab, standing for sexual orientation, gender identity. And it's something that you can click and update both name, pronouns, gender identity, and sexual orientation in a way that it is there and present for yourself and whatever providers that might see this person in the future to allow them to be keenly aware of affirmed name, affirmed pronouns, sexual orientation as it's relevant in that visit. As pediatricians, it's important to assess a few things before you move forward with updating this. More notably, whether or not the young person has shared that with their family, whether there is any concern for that information being shared with their family or any other providers, just knowing with MyChart and open note access and all that, if this information is updated, it's visible to anybody, including anyone who has proxy access to their account. So just being really thoughtful around making sure that that young person feels comfortable and safe with updating that information before you do. But if that is the case, this could be a really powerful tool as the person navigates the healthcare system to really try to optimize the likelihood that they are being met with their affirmed name and pronouns. So on that note, first impressions really do matter with young people. Youth can decide often within minutes if you're somebody with whom that they can confide. So ensuring openness is key to establishing rapport with all youth, but I would say particularly with queer and gender diverse youth. While the phrasing that you use and feels comfortable or natural may be different than mine, some of the more common approaches can be as simple as, for introductions, hi, my name is Dr. Meyers, I use he, him pronouns. What pronouns do you use? The name I have here in the chart is, whatever the name is there. Is that the name you use or do you go by something else? What name should I call you? Just really from the beginning of the encounter, being really intentional around sharing both your name and pronouns, but also making sure that you begin the encounter in a way that allows you to be reflective of that person's affirmed gender and identity. And again, creating that safe space just takes a lot of intentionality, and practicing your language around the way that you frame that over time will allow it to become more comfortable and easy. And I will say doing it universally with all of your patients is really critical too. Just as a note, I would practice caution around the term preferred pronouns because it implies a preference and not a core part of a person's identity. If you notice, I use the term affirmed pronouns, and we've really stepped away from preferred just for that reason. So again, continuing on with like, how do I ask? How do I create that safe space? I'm one-on-one in the room with the patient. What can I do? I chose this picture because I really like it. Demonstrates a lot of the, like, again, simple tools that people can use as like a reflection of their dedication to the community, including pins. Pronoun stickers have been really important and helpful. But really kind of the most important thing I can say about the clinical encounter is that confidentiality is key. So you can do everything to create a safe and welcoming space, but unless you ensure that that person understands that you will respect the confidentiality of the conversation, you're less likely to get the most robust information from them, just because that relationship and that trust comes from you kind of being intentional in developing that trust through outlining confidentiality. And as we're all aware, the California Family Code does protect these conversations happening in a confidential way, so you are well within your to be able to do that. So ensuring confidential spaces is critical. Like I said before, assessing sexual orientation and gender identity universally for all of your patients is critical. Asking open-ended questions that don't imply binaries is really important as well. Open-ended questions allow much more fluidity in response and affirms that you're approaching patients without assumptions. Not all persons' experiences or identities project onto the experience or identities of yourself or the other people in your practice. So each patient should be approached as an individual without a preconception or assumption. Meeting patients where they are will enhance patient-provider relationships and avoids the perception of stigma on the part of the patients or ascribing pathology by asking certain questions after other information has been shared. And then also, practice humility. Humility is super important. We're all human. Will slip up at times, make an assumption, misgender a person, use a name they no longer use, or a dead name as it's referred in the community. In this case, simply stopping, acknowledging that it happened, apologizing, and moving on is a really powerful approach. Some other useful tools, again, I think it's important to highlight that it's critical to assess sexual orientation, gender identity, and birth assigned gender as separate entities. Regarding gender, there's been a lot of research around using a two-step method, which allows you to assess, as you can see here, gender identity as current gender identity and sex assigned at birth. Because if you think about it, if there's people that are transgender and affirmed in their gender, it might be the case where they would mark male or female as their affirmed gender, and lacking the question that addresses the sex assigned at birth can make it difficult to really understand the true trajectory and the arc of their gender journey. So asking gender in a two-step approach as outlined here is really critical to be able to capture that information in a useful way. Also important to highlight here, making sure there are plenty of options, including an other for all of these answers. I think youth have a much more expansive vision of sexual orientation and gender identity, certainly than I had growing up. And so making sure that there are plenty of options to respond in a way that feels authentic and appropriate to them is really critical too. And then also this image I wanted to share, I think this is one that really captures all of that really nicely, and one that we have posted in our clinic, again, as a sign of allyship. And promoting open conversation around all of these topics. And so this is the gender-bred person. Again, it talks about identity, which is how you feel and how you see yourself, sexual orientation or attraction, biological sex, and gender expression, which is the outward expression of your gender that you show the world. And so strongly encourage people, if you're inclined, to kind of post this in your clinic, because it's been a really useful tool for opening dialogue. If using paper forms, I always make a point of asking again, one-on-one in person after confidentiality has been established, because what I've seen and what has played out in the literature is young people are often afraid to mark down things that they feel are sensitive on paper. It feels more formal and official. So kind of establishing a confidential space and asking those questions again does allow you to better capture that information. Also, if you're assessing sexual behavior, do not assume orientation dictates partners. Just because somebody identifies as gay doesn't mean they only have same-sex partners. Because somebody identifies as heterosexual does not mean they have only opposite sex partners. So really kind of adding that in as an additional in your HEDS assessment question, and really kind of understanding the partners that that person has so you can give accurate and useful feedback around sexual health counseling. Like I said, sexual orientation and gender can be fluid, and it is much, it's very important to acknowledge that for the youth that we're seeing. Life is really kind of an ongoing journey of self-realization, and taking an approach that allows patients to share where they are right now and what has gotten them to this place is critical. They can be sharing their queer, gender, diverse identity as a recent self-realization and identity they've recently had the ability to understand, appreciate, and hopefully love. Over time, it could be an evolution of a prior sexual orientation or gender identity, or a combination of any of the above. Somebody's not ready to share, that's okay. Oftentimes in the initial visits, you're really kind of establishing rapport and creating that safe space that will allow them to share in the future. These relationships just take time to develop. When responses change or vary, it's really important to note that the clarity of the answers does not by any means reflect a lack of clarity and understanding of sexual orientation and gender identity, but more a reflection of their journey of self-exploration. And as such, it's important to really reassess sexual orientation and gender identity regularly through physicals at least, acknowledging that gender and sexual orientation can be fluid. So if somebody does share with you that they identify as queer or gender diverse, it's important to ask a few things. One, just ask very openly if there's any specific questions they have. And I will say, don't assume people are troubled. I think the world today, at least in the Bay Area, is much more open and accepting. And a lot of young people coming to age now have not experienced a lot of the collective trauma that somebody my age may have experienced through the coming out process. And so don't make any assumptions. Don't assume people are troubled. Just really kind of open the space for them to share whatever questions they may have. Asking if they're interested in any info on youth affirming spaces or support groups. There's a tremendous network both in the city and down here, largely in San Jose, that allows spaces for young people who are queer or gender diverse to come together and really have a community. And that could be a really powerful tool towards developing resiliency as well. So that's an important thing to connect people with. And then finally, really kind of understanding who they've told, what that response has been, and whether or not there are any safety concerns that you need to be aware of as they perceive them. And that allows you the space to kind of proactively plan when a person is ready to kind of share that information with the people in their lives, to do it in a way that feels safe to them. And then, of course, like any visit, you want to make sure that you do the rest of the HEDS. I had to shamelessly plug that as an adolescent medicine provider. Some of the tools that can be really helpful that allow you in a very busy encounter to capture some of the things that the community is more likely to experience include screeners that assess body dysmorphia. The SCOFF is a really simple 2-question questionnaire that you can ask people. Assessing substance use through the CRAFT questionnaire. Again, really simple, time-effective tool to assess substance use. And then the PHQ-9, the GAD-7, and the Columbia suicide screening are really useful tools to understand the mental health needs of young people. And then supporting sexual health. Discuss contraception and needs as appropriate. Again, not making any assumptions based on partners off of reported sexual orientation, so really being intentional about understanding each person's sexual practices and contraceptive needs. I feel really fortunate through my training to have been able to develop the skills to do Nexplanons, IUDs, and all of the array of different contraceptive tools that we have. But if that's not the case for you, understanding who you can refer to and connect people to as those needs arise is important. Making sure we're offering comprehensive, confidential sexual health testing and treatment. And again, this is also protected by the California Family Code. And so this can be done in a way that parents are not aware of. Really understanding the guidelines and the indications for PrEP and PEP and offering as desired is really important. And then just some other general tools that I think have been really helpful to make sure that youth get positive, affirming, and accurate information, including this pamphlet, which is titled Safer Sex for Trans Bodies, which has been put out by the Human Rights Campaign, just as a way of really kind of giving somebody something that they can take home and read that, again, is accurate. In supporting gender health, there's a few other important considerations to think of, really kind of understanding that gender journeys are unique to each person and not everybody's journey looks the same. It's important to familiarize yourself with the broad range of both medical and non-medical forms of gender transition that exist, starting with social transition. Social transition includes things like haircut, clothing, social activities, sports, things that do not require medical intervention, and any and all of us can provide counseling and support around. Medical transition, while we might not all be as familiar with the nuance of prescribing GnRH agonists, puberty blockade, gender affirming hormone therapy, just knowing that these tools exist and what resources in the community you can refer patients to as those desires arise is really important. Menstrual suppression is another one in a lot of transmasculine people or non-binary people. Menses is really dysphoria inducing. And so we have plenty of tools, including combined oral contraceptives, IUDs, agestin, that can be really helpful to kind of allow people to have none or less menstrual cycles in a way of kind of using that as a tool to alleviate some of that dysphoria that can exist when that doesn't align with your gender identity. Binding is the common practice, again, in transmasc and gender non-binary people. There's a lot of information in less healthy ways of binding, and so making sure that you're familiar with those, but also pointing people in the direction of safer ways. And this is an image from the G2CB website, which is a company owned by trans individuals that makes binders. And I think this is really wonderful because they make binders that are in many different skin tones and that are designed in a way to kind of allow you to have like full inspiratory effort and breathe comfortably and wear them throughout the day without some of the medical challenges that can come with less safe methods. Also, vocal therapy, so much of gender as it's perceived comes with the way that people speak. Pitch, resonance, intonation, there's a lot of gendering of language. And so another resource, again, that doesn't require medical intervention that we can all connect people with is vocal therapy. At UCSF, it's through the ENT department. I don't know who owns that here, but that's been a really useful tool to make sure people have that as a resource to be able to allow their voice to match their gender identity as well. And again, really importantly, just legal documentation, passports, driver's license, all of those things that can be really important to ensure that the name and the gender on those documents matches the affirmed name and gender. And so kind of connecting people with the process of updating and making sure that those documents are reflective of their current identity is important too. And again, doesn't require any medical intervention. So we all can do that. And then finally, some additional resources that might be helpful. The Family Acceptance Project, which grew out of San Francisco State University, is driven by social workers in a way that is designed to create a space for young people who have perceived risks around coming out to have a space to do that with their family present, with a trained mental health provider to be able to negotiate that conversation. Mind the Gap also exists in the Bay Area. If you go to the website, there's plenty of information on there. There's also specific providers with like expertise in the queer community, more specifically with gender therapy. And so that's a really great place to start if you're like, I want to connect this person with a mental health provider, but I don't know where to look. Familiarizing yourself with clinics that can provide gender affirming hormone therapy. And I know there's a really wonderful team here. Similarly, there's a wonderful team here using evidence-based medicine to treat substance use disorders, so that's great. And then also just familiarizing yourself with all the different CME opportunities that exist if this is something that you want to take a deeper dive into. WPATH, which stands for World Professional Association for Transgender Health, does a really wonderful introductory course that's all virtual that is really useful for people to kind of better understand the nuts and bolts of gender care. And so that was a really wonderful resource as well, in case you have any extra CME bucks. So focusing on some take-home points, LGBTQ advocacy has brought us closer to equality. Challenges still certainly exist. Creating affirming spaces for youth takes intention. There are no binaries. Youth are creating space for a more expansive worldview, and many resources exist out there to help support LGBTQ youth, so just ask. Finally, any questions?
Thank you so much for sharing all those wonderful resources. We'll take questions now.
Thanks for that really great talk. You know, the thing that is still really interesting in the field is that all of the theories of developmental psychology assume that gender identity was fixed. And it's very clear these days it's not. And I'm wondering what we're learning about that and how we think about that in terms of early childhood guidance and development.
Yeah. I think it's a great question. I think, like I noted in the talk, we are realizing more and more that gender is fluid. And I think one of the benefits of having young people present before puberty starts is that there's no medical intervention and you can allow the time and space for that gender to evolve in a way that was previously thought to be set at a young age, to give that person space before any potential interventions are necessary to allow that identity to develop. And so that's good. But yeah, I think you highlight a really important point that we're still learning more and more, and ongoing research, like in everything, is going to be critical to really understanding that.
And then for the people on Zoom, if you could introduce yourself before you ask your question.
Sure. I'm Alex Bovinell, and I'm a clinical psychologist in HEMONC, and thank you so much. I just had a quick question for you around guidance regarding when you suggest having that conversation with kids from a developmental perspective. I really appreciated and loved how you modeled walking into the room and here are my pronouns and what are yours. When do you suggest starting to do that with kids, as we know that they are having those pieces of identity awareness at early ages?
Yeah, I think as early as we can, the better. I personally, as an adolescent medicine doctor, don't see people under the age of like 12 or 13. And so for me, it's a part of my practice for everybody, but just asking in a way that is developmentally appropriate and kind of gently opening the conversation with younger people could be really powerful too, to allow you to understand any gender diversity that might exist at a younger age, which we do see in the Child and Adolescent Gender Center, which I work at. And so those referrals often do come from parents having conversations with their young person at home. But I think, again, us being able to create that sensitive space might allow for that information to be captured. So as early as you can, I guess I would say.
Hi, I'm Connor. I'm a first-year resident here. Do you have any advice or kind of dialogue to give parents when they're approaching this conversation with their child? Like, I guess kind of following that, any advice about when we should give them or when they should start this kind of conversation with them?
Yeah, I think similarly to the last response, as early as you can, as long as it's developmentally appropriate and you're in a place where you think the young person can understand the questions that you're asking. And I think the advice that I personally give to parents is similar to the advice that I gave us as providers, just kind of leading with curiosity, asking open-ended questions, ensuring that the person you're talking to is aware that that conversation is a safe one and that they don't have a perceived sense of fear around your response to their actions. So really kind of making sure that as a parent, you have that comfort and that relationship, and creating a safe space to have that conversation is critical, but really just kind of acknowledging the diversity that exists and allowing people to kind of identify and define themselves over time, and acknowledging that that might change.
So I think what I hear you saying is really encouraging parents to talk with their children early about who they are and how they perceive themselves, and have that conversation ongoing and continuous. And I can imagine that that conversation might be around kind of all parts of their identity and not just gender identity. Because I think about when I talk to residents and talk to parents, we also have those conversations about race and also about what we think about who we might want to be when we grow up. And so I can imagine as we talk to parents about having those conversations about gender identity, we can wrap that up in all of those things and make it feel much like a less fearful conversation and much less loaded in this current environment that we're in.
Beautifully said.
I did have one question for the Mind the Gap resource. I was curious if they have psychologists that actually take Medi-Cal.
They do.
Oh my gosh, that's phenomenal. For people at Gardner, please remember that that resource exists. We have one question online asking about whether or not gender transition surgeries happen in children.
So the answer to that is it depends on where you are. In California, yes. Surgeons in the Bay Area have been performing a chest reconstructive surgery down to the age of 16. There is more hesitation, and it's less likely for people to have genital surgery until they're 18, but chest reconstructive surgery has been something that we've connected patients with down to the age of 16.
And as we consider gender identity as fluid, I can imagine that the decision to do the chest reconstruction surgery at 16 may work well around that idea of gender identity being fluid.
It does. And acknowledging that, we want to make sure that that is a decision, knowing that it's permanent, is one that that person has clarity around in that time. And so part of the process of getting approved for surgery requires 2 letters from mental health professionals that can comment on your gender journey, your affirmation, your lived experience, and really kind of provide the foundation that this is a decision that is one that you've come to knowingly and willingly.
So it confirms that that person is kind of past that state of fluidity, or kind of.
Not necessarily, but it confirms that that person has had the time and the clarity to unpack what that means for them and has made the decision to move forward.
Thank you.
And of course, anyone under 18, it requires parents' consent.
Thank you.
Hi, I'm Mike Liu. I'm from engineering actually, but I've been paying attention to medicine in my schooling since since early on, which might be earlier than you guys think. If I remember correctly, you mentioned to allow patients or those you see to, if they have any specific questions, ask them. So at the risk of creating too unspontaneous of answers and too broad of answers, non-specific, what are some of the questions that have come up aside from what you've already touched on and what's been asked?
Yeah, I think a lot of the questions that come up are centered on like sexual and reproductive health. I think that is one that we all can do a better job in the educational system of being more inclusive on. And so people that don't fall in the heterosexual cisgender identity don't necessarily get the same education around sexual health. And so a lot of the questions that stem out of those confidential spaces do center on that. A lot of young people have access to their phone and the internet, and there's varying degrees of reliability of information that they come with. And so just another plug for having those conversations to make sure that the information that they go home with is valid and appropriate is really important.
Thank you so much, Dr. Meyers. We really appreciate your wonderful talk. This was a wonderful grand rounds for our last grand rounds of the year. Everyone have a wonderful day.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.